My patient is a 60 years old male who was diagnosed with MS 15 years ago. My patient uh, 1 year ago was able to work with a walking frame, and then now he was used is a wheelchair bound. Uh, there's no much history about the past medical history. It was not given. I mean, apart from the sclerosis, any other history about what has happened, what has associated with it. But the past mobility was the patient could walk then with walking frame, and then now walk is a wheelchair bound. So and then presently the patient is uh, bed mobility, yes, dependent with the bed mobility with the minimal assistance, and also patient could transfer from bed to wheelchair with a moderate assistance by support worker during the day. So and then in the evening the wife do assist him. So we have limited information about the patient family and social history, but the from case wise reported that the patient live with a single story house. There's no steps, so it has ramp in the front and the rear, and possibly there may be modification by occupational therapist. Not sure. Maybe I'll find out when I see the patient. The patient, I guess, the patient live with his wife, but no more information given about the support the wife is giving to him. So and apart from that, the patient presently conditional status is a wheelchair ban, like I said, and then there is been no history of falls, and then the patient doesn't drive. The transportation has been provided for him to move from one place to the other, and then patient has been also been receiving physio. There's not much history given about the physio the patient has been receiving, but the patient has been receiving physio. So all these things I will clarify all this information when I see the patient. I ask about the medical history, and also I will also ask about other pertinent history about any incontinence. I will ask about that one, and any incontinence issue. And then I'm expecting to see my patient, very weak person, maybe easily fatigued, and then is very weak, both upper limb and lower limb, and then possibly have the problem with his vision too, and possibly hearing. And then I'm expecting the patient that will have impaired cognitive, I mean impaired proprioceptive, proprioception, and yeah, and coordination problem too. So my patient probably have to see give a referral to my patient, maybe possibly to apart from the refer the patient for the community physio, probably to hydrotherapy would be of benefit to him, and also possibly for inquire about the financial status. Patient may be benefit for social worker if he has not been receiving one before, and also possibly find out and digging deep further about the way patient is having a treatment with a psychologist. If not, I have to give a referral to that one also too. And also I have to dig and find out about the occupational therapist. If there not been any modification for him to make it things easy for him, then maybe possibly I give a referral for also occupational therapist too. And I also have to ask about the incontinence. If there's any issue with that, possibly I have to uh, find out about that. So I'm going to ask my patient about I find out about his goal today, and then based on my patient goals and then on my own assessment, I'll take my patient to the highest functional level, and then do that. Okay. So I proceed straight away. My name is John, and I have my assessor Van, my second assessor is Michael. So they are here to assess me today, and then possibly if they give me assistance, and then also they will, anything to, if I need any assistance, they give assistance to me, and then uh, also to, if they will assessing me what I mean on my conduct today. So I need to just today is a like exam exam scenario situation. So I have a very limited time with you. Uh, so and then the exam is going to take the scenario is going to take. I'll ask you some questions and then do the hand-on assessment, and then based on your goal, then I will do the treatment and do the treatment also too. So before I proceed, I just want to find out your name to clear up some things.
My name is Steve.
Okay, Steve. Steve, just to clarify from you, you're 60 years old.
Yeah, that's right.
Okay, and when were you diagnosed with the multiple sclerosis?
So I was diagnosed almost 15 years ago.
Okay.
Yeah.
Okay. So since you have been diagnosed with the multiple sclerosis, where I saw here you receiving physio. How often are you been receiving physio?
Uh, Now the doctor has referred me to the outpatient department.
Okay. So you've been receiving physio or not?
Nah, I'm coming over here today for the first time to
Or
the
for the first time today.
Yeah.
Thank you very much for that. And then way back home, and then how do you go about your, I mean, when you all this while, how do you go about the movement, transfer from the chair, from the bed? How you been going about this? Your wife have been assisting you doing all this stuff?
Yeah, now since last 1 year, things are getting worse. Like I can't do much things. Um, I can move in the bed. Sometimes I need some help. Uh, but I find it difficult to sit by myself.
Okay.
And then from sitting to the wheelchair, I need someone to help me.
So when you are on the bed, how do you get up from the bed to the chair, to sitting up? You do that by yourself?
I can do it, but I need some help, like
You need some help.
very minimal sort of help.
Okay. And then from the when you're sitting down to the wheelchair, how do you get to that one?
My wife helps me, and I use a transfer board to
Okay.
to go.
So and during the day, do your wife stay with you all the time, or does she stay in the house all the time, or
Yeah, now she stays in with me. She's a carer right now
or she's a carer right now?
for me.
Okay, good. Uh, Frank, am I right? Frank, Steve, sorry. Steve. Before this, before you have your multiple sclerosis, what were you doing before? What kind of a job you did before?
I used to drive a truck, but I gave up on it ever since last 15 years.
That's 15 years.
Yeah, so I'm just I haven't because I started feeling the symptoms.
Okay.
Yeah, so I gave up on my job.
So and then also to the kind of hobbies do you do at that in that year?
Uh, I like playing video games at times. I like reading books.
Does this condition prevent you from doing all these things now? You're still able to do it.
I'm still able to do it, but sometimes I feel so tired, and my vision actually starts getting a bit blurry when I'm playing too much
Okay.
video game or reading.
Okay.
Yeah, and sometimes I get so headache sort of when I'm reading too much,
Okay.
like pain wise.
Okay.
So I think so. It has to do with my multiple sclerosis.
Okay. And then apart from this, before you have the multiple sclerosis, between years ago, or after you have, or before you have, is there any other medical condition you have that you maybe like you loss of weight, and then maybe arthritis?
No,
No, no any condition.
no,
you're
no
aware of.
conditions I'm
Okay.
aware of.
Okay. And then you presently, I know you are not having any history about your medication. Are you on any medication for your multiple sclerosis?
Yes, some medications they give me, and sometimes they also give me some muscle relaxant.
Okay.
I've been having this immense pain in my here, like
Okay.
muscle, like a spasm. So that muscle relaxant helps me.
Okay.
That spasm is getting so worse that I used to do the self cathetering, but it's difficult now because of the spasms.
Okay. So now, and I want to ask again to do you have any incontinence problem or urine or
Yeah,
fecal?
ever since last 1 year, it's getting worse. So I'm incontinent of urine. I use a catheter just in case.
Okay. Well, in that kind of situation, I think I will have to do, and then I will give you a referral. There's some group, maybe the physio group, special group. They work on that kind of on the pelvic exercise, training, all this kind of thing. Give you referral to that. Will that okay for you?
Yeah, if that helps.
Okay, and then beside that also to give you referral to the community physio where they do in group physio for muscle sclerosis group and then do all those activities for you in the community. Is that all right?
Yeah.
So now I'm not so sure about your financial. You are because I know you live in uh a single story house. Is that right?
Yeah.
And then you have a no step, you have a ramp in the front and the rear.
Yeah.
So the ramp was it adjusted by someone or it has been there before?
No, just a year ago, we got that approval for NDIS,
Okay,
and the occupational therapist through NDIS, she put the ramp.
okay. So with it, that's good. But I'm not aware about that. Then when you had a therapist put the ramp, is there any other thing you find difficult now to do in the house? And then even with the wheelchair, and you couldn't do it
Uh,
properly.
yeah, she did that ramp a year ago, but
Okay.
like I said, I find it difficult. Means it is easy, but I still need some help from lying to sitting position.
Okay.
So
Yep. So possibly what we will happen to do is do that. I will give a referral to you to occupational therapist. It
yeah,
could be of help. We could get kind of devices that will kind of supporting you
yeah,
getting from lying to sitting position. Is that all
yeah.
right?
I feel that would be better.
Yeah, I'll give a referral to that too. So and yeah, your wife is you said your wife is your carer now. Do you how old is she?
She is 52 years old.
Is she very capable of doing all these chores for you, taking you down to the bathroom, all those stuff like that?
She is capable, but we have a support worker also comes who helps.
Oh, okay.
Through NDIS, we're getting that support worker who helps. So my wife is not too much stressed and
Okay.
overwhelmed by it.
Okay.
Yeah.
Then I want to ask again about financial issue. Do you have any problem with that?
Uh, Financially means I'm on a pension right now,
Okay. So
so that helps. And then we have the NDIS funding, which helps for my other activities, like if I want to go shopping and all,
okay.
for the house modification. So I think we are going okay.
Okay. And now with your vision too, and then you could see properly, or you find it very difficult
I
to
can
see.
I can see properly, but sometimes it gets blurry, sort of.
Do you think we got to give a referral to optician? Maybe maybe get glasses for you or sort out those kind of things for you. Is that all right?
Yeah, I think that would be better because this is a new thing which is happening. So
Yeah.
sort of last 2 months.
Okay. How about your hearing? Can you hear properly or you find it difficult to?
No, I can hear properly.
Okay, hear properly. Okay, that's all right. So I just want to clarify all those ones, and then from time to time, do you feel depressed? You feel down, discouraged? I mean, worried, depressed? Do you look? depressed often?
Not too bad because I've come to the acceptance now. It's been 15 years that I've been having this.
Mm.
Initially, it was a bit difficult, but now I'm used to it.
Oh, you used to. So you not really feel you look you good you feel good, right?
Yeah, I feel
Okay,
generally
because
okay.
yeah, because I've just given you referral to psychologists. Maybe they have discussed with you, and then kind of anything they could offer any help, kind of support to you. Do you think that you need that one? I give you
No,
referral.
I think I should be fine.
Okay, thank you very much for that. So, that's the information I really want to get from you. So, like you say, moving from one place to the other, your wife, you mean, have to push you with a wheelchair, right? Or can you prepare that yourself?
Uh, I can, but towards a point, I get so tired sometimes,
So,
fatigue. So
okay, where do this fatigue set actually set from? Is it of the arm, of the leg?
the whole body actually, like it's like a fatigue, like when I try doing too much.
Do too much? Okay.
Yeah.
So if you would do how the activities that you do, like how long? Maybe in a minute, maybe like 2, 3 minutes, and then you get fatigued. How?
So like if I do something for 5 minutes, then I get really tired.
Okay.
Yeah.
Do you find it difficult to breathe? Does it affect your breathing?
I'm not sure. I haven't noticed that.
Okay. So you
Breathing, I think so. It is normal.
is it normal? Okay. Okay, that's all right. So when you after all those activities, if you sit down, how long does it take you for you to recover back again?
Uh, Quickly, like within a minute or 2 minutes.
Oh, you recover back again.
Yeah, but
Okay.
I still means I can't do anything like continuously more than like any strenuous things.
Oh, okay. So just do bit by bit, right?
Yeah.
Okay. Thank you very much. So I just want to know all this information to then do you have any pain anywhere?
I generally get pain throughout my body if the temperature, like if the temperature becomes warm or
Okay.
hot.
Okay.
Yeah.
So usually in the afternoon in the summertime.
Yeah, in the afternoons or summertime.
So do you have any medication for the pain?
I
Or
think,
do you have to put on the air condition
yeah, I generally prefer not doing anything in the hot weather.
in the hot weather?
Yeah.
Okay. Okay. So
But if in case the doctor has given me some pain medication.
okay. That's all right. So I just then do you have any no pressure sore and any wound anywhere?
No. So I keep trying to move myself, like
Okay.
just to avoid any. My doctor had told me about that once before.
Okay. So but now you could sit by yourself on the chair. You don't need an assistant for somebody to hold you
I think I can sit if
on the
I
chair.
chair by myself,
Okay.
but
I mean, be on the chair independent sitting. Or do you need to
that's getting worse. I think it means I cannot. If I want to grab a book or something which is a bit far, I find it difficult. Like I feel my balance goes.
Oh, okay.
If my phone has fallen on the floor, when I try to reach it, I can do it, but sometimes my balance goes.
So you find problem with your balances, right?
Yeah, that's right.
So why about trying to pick something? Maybe pick your phone. Do you able to pick it yourself, or you find it difficult to pick something on the table?
Picking is fine, but it's
Okay.
I think the balance is the issue. Like
Is the issue now?
yeah.
Okay. Okay. Thank you very much, Steve, for the information I've gotten from you. Like you said, you taking your prepare all the referrals and the letters give to you at the end of the sessions. So the next one I'm going to do now, I'm just going to do handle assessment on you. Is that okay to go ahead with that?
Yes, please.
Okay. So just want to do then before I go ahead with that the annual assessment, I need to ask you very importantly the goals you want to achieve today. Like you have, like I said, we have a very short time. So like I say, this goal is is what you want me to do for you at this time. Then there's another long-term goal that's short term. That the long-term goal is what you think about getting done in the near future, 6 months,
Uh,
a year.
I don't know. It's probably if I can work on my transfer, like because I'm so heavily reliant on the support worker.
Mm.
So if I can improve my transfer,
Okay. Your transfer
wheelchair to
from
bed,
wheelchair to bed.
yeah.
Okay. Okay. But you wait. Then you talking about you got a pain on your shoulder. You said you got a pain in your shoulder.
No, I don't have.
You don't have any pain. You get and then is there any weakness at all? I will check on that one. So is there any weakness, any tiredness? I mean, fatigue on your hand?
When I do too much, then the whole body gets tired.
Oh, okay, okay, okay. So, Steve, I will check. What I will do, I will do the assessment and see your capability, and then we check how balanced you. I mean, how good your balance is. So, because the balance is very important too. Because talking about transfer, if your balance is not very good, you can't do transfer. Yeah, because that's the basic thing. You're able to balance, dynamic balance. I mean, static balance still by yourself without swaying, and then dynamic balance able to move. So that one is very very important. We can't do those two. It's not really possible to do transfer because that would be forceful. Then I forgot to ask you previously, any history of fall? You have any falls before?
No, I haven't had. I'm really careful. Like,
Oh, that's good.
yeah.
That's good. Oh, thank you very much. So, you work on that leadership. And then for your long term goal, what do you think you want to achieve for your long term goal?
Probably becoming a bit more stronger.
More stronger?
Yeah.
Oh, okay, okay. Yeah. Oh, well, that is more stronger in your
In your arms.
in your hands,
Yeah,
and
in your trunk.
in your trunk. Okay.
Yeah.
Okay. Yeah, that's well, yeah, that's good. You work on be able to do things, carry objects, and then you may not getting very very stronger, but maintain the strength that you have,
Yeah.
and then preventing the muscle wasting away. Is that okay?
Yeah, that sounds good.
That's good. So that's the reason why I'll give you referral time to the MS group and then community group. They work on that for you, and then community participation. Then help on your endurance, and then help on the fatigue as well, and then other programs they will give to you and other information to help you to be to cope with these the symptoms.
Sure.
Is that all right?
Yeah.
Okay. So thank you very much for that. So the next thing I'm going to do now, I'm going just to do the assessment. I mean, hand-on assessment. So I need your consent for me to go ahead and do that.
Yeah, sure. Go ahead.
Steve, before I come in, I came in earlier time. I already did my hand wash. So yeah, just be aware, and then because of the health and hygiene reason. So I'm going to just check something out. You just say because your eye is all right. You see me properly. Is that all right?
Yeah, sure.
Okay. So just check your side. You just check your side. Is that all right?
Yeah.
So I want you to look at my hand.
Yeah.
Yeah. And then you just don't move your hair. You just look at my hand. Okay. Like look at my hand. So I move my hand to left and right. Just follow it, but don't move your head. Just want to check without. Okay. I'll do up, down again, and then I'll just do it. Then I'll bring it closer to you, and I want to see all this. Then I'll move to this side. Don't move your head. Don't move your head. It's you bit moving your head. It seems that you have a little bit challenge with your eyes.
No, I mean, it's just that a bit blurriness sometimes.
Yeah, I could see that.
Yeah.
So possibly, what do you think about you seeing referring down to see your ophthalmologist?
Yeah.
That would be of good to
Yeah.
you. Okay, so that's good. All right. How about you? Your hearing? You said a problem with hearing?
No, I can hear it clearly.
Okay, that's all right. So now, what you want to do now? I just want to check your coordination. So now you touch you use your hand, touch my hand, top of my hand, and you put down to the tip of your nose. Do that 5 times. Sorry for asking that question. I'm sorry. I could have just, I need to check your strength for that. Actually, I've done that before. So, can you bring your hand together? Out. Yeah. Now. Okay. Just want to just quick one. Bring your hand together. Out. Okay. Squeeze my hand. Okay, that's all right. Then bring your hand together. Out. Squeeze my hand. Okay, that's all right. So just want to just check that one before you proceed with that. So just know that you have strength in your hand before you can carry out the action. So like I said, you touch my tip of my finger, then you bring that to your nose. You do that 5 times.
Okay.
Okay. Okay. You do the second one too. Okay. That's all right. So the coordination are very good too. So yeah, what I said, last time, you have a very good coordination for you to talk about the transfer, me transfer from chair to bed. So they are the components you necessarily need to have before you talk about transfer from chair to bed or from bed to wheelchair. So now, another one I need to do now, I just want you close your eyes and then you open your eyes first. I'm going to move your finger up, down. So this is down, and this is up. So when I do that, you tell me whether it is down or up. I've done. So just to tell me. I want you to close your eyes now.
Down. Down. Up. Down. Up.
Okay. So I'm going to do the same thing with this hand too. Is that alright? So you close your eye, then you tell me whether it's down and it's up.
Up. Up. Up. Up.
Okay, that's alright. So it's also to the joint sense also too is also affected. So you wouldn't know whether it's up, whether it's down. So that's all those things that affect your transfer. So you have to work on all these things. You can't correct them, but you have to component of balance is very important. So what do you think? Maybe work on the balance. Do you think about that? How do you think about that?
Yeah.
So I want to check the same what I've done on your on your hand. I'm going to try the same thing on your legs to see if there's anything needed to be done. Is that alright?
Yeah.
Okay. So I want to just leave it like out in again.
I feel tight actually in my muscles.
Where do you feel tightness?
Like here, the back.
Okay. Is that how far you could go?
Yeah.
Back again. Do you have any pain or just tightness?
It's just tightness.
Okay, back again. You do this for me. Is that how far you could go?
Yeah.
Okay. So I'm just going to check your leg and see if you have any we call that spasticity or something like tightness, spasticity.
Yep.
So let me just check. Okay, that's all right. I'm going to check this one too. Okay, I'm going to check this one too. Okay, that's all right. I'm going to do the same thing again here.
Yep.
I want you to leg out, push the leg out, and in again.
Yeah. I can still feel that same.
The same? Okay. Here, okay, down, okay. So I'm going to check again. See how you feel this hand. We're going to do this one again too. We're going to do this one. Alright. Yeah, I can also see you have a tightness on the limbs, so that also doesn't prevent you, I mean, cause of the pain, and then prevent you from carrying on activity, because if this very, if you have a tightness of the muscle, then it prevent you all those, the shifting of weight and transfer, so it could affect it as well. So all these we try to avoid, we try to address them when we try to treatment. So now the next one I want you to do, I want you to just take your coordination like I did on your hands. I want you to just, what you need to do, take the right and put on the left and do this way as fast as you can. 5 times. Okay. Okay, that's all right. Okay. You do the same thing to this one too. Okay, that's all right. That's all right. Now I want to close your eyes.
Yeah.
And like I did for the check for the joint strength to find out where, I mean, you tell me this is down
Yeah.
and this is up. You tell me whether it's up or down.
Okay.
Okay. I want you to close your eyes.
Up. Up. Down. Up. Up.
Okay, that's all right. So I'm going to do this laughing to this one too.
Yeah. Up. Up. Down.
Okay, that's my doing 5 times. So, like I said, it happens on the hand too. So, like with the same thing repeated on the leg. So, you will know where the whether is up, whether it's down. So, this is issue with coordination, and then affect the coordination. Joint sense, you don't know where it is, and that is the reason why it affects your balance too. So, that's the reason why talking about the balance, maybe your short-term goal for work on the balance, is that all right?
Yeah.
Okay. And then, any problem with the sensation?
Sometimes it feels a bit numb.
Okay.
Yeah.
Yeah, I think it possibly have to check the sensation too to know if anything wrong with the sensation. What I'm going to do, I just take your face, and face will tell me it's normal, and then if you can't feel anything, say it's not normal. Say no. So yes, no.
Yeah.
Yes, no. When it's yes, it's no. No, it's not no.
Okay.
So just feel it. Do you feel it?
Yes.
This is yes. Okay, close your eyes now and just tell me if it's normal or no.
Yes. 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 Normal. Yeah.
So I'm going to do it for the lower, to your left now.
Yeah.
I'm going to do the same thing. Yes or no.
Yes. 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 A bit less.
Okay.
No.
Okay.
Yes. No.
Okay.
No. Yeah, a bit less. A bit less. Yes. Yes.
Okay. So conducting the sensation to the same thing review with itself. The sensation is not very superb, just impaired sensation in lower leg, very good in upper leg, but in lower leg, very impaired, especially toward your feet. So all these things contribute to balance and transfer. So I think From my point of view, I think, what do you think you will work on the balance today?
Yeah, sounds okay. Sounds good.
Okay, so before then, I just want to just check your when you're on wheelchair. I just need to just try as much as sit very well. Okay, you sit very well. You sit very well. Okay. Okay, that's all right. Sit uprightly.
Yeah.
Okay. Okay. I just want to just try to. Can you try to as much as can you pick this thing from the floor for me? Yeah. Over here. Your side. Okay. That's all right. That's all right. Okay, I'm going to just try how you could cope with your balance. You just take that one off.
Yeah.
So for this one too, and then the therapist will be on that side with you.
Yeah.
I don't want to pick this thing on the floor. As soon as it's on the floor, you pick it up. Okay, give it support again too. That's all right. So reason why I'm trying to do all this thing just to check how your balance, how good is it. So yeah, so you could sitting down by yourself very good. I mean for a while, for a short period, but the dynamic balance that is you move from one to the other is impaired. And then without really good dynamic balance, you can talk about transfer. So how about talking about working on the dynamic balance today?
Yeah, sounds good.
Oh, that's good. So now in this is now getting down to the next step of the treatment is to work on your balance today. And yeah, working on the balance today. So because you're working on your balance today and your balance is very good, then definitely we'll be talking about you do transfer. Is that
Yeah.
alright? So you to do transfer and then maybe to do other things.
Yeah.
Is that alright?
Yeah.
Okay. So now I just want to just sit properly. Put your leg together. So put your leg together. So I just want to do what you need to do. I want you to touch my hand.
Yeah.
Touch my hand. Move forward, touch my hand. Back. If you feel tired, just let me know.
Yeah.
Okay? And touch this hand.
This hand?
Yep. Okay. Can you sit properly? Put yourself up. Move forward. Yep. Okay, that's alright. That's alright. That's alright. Okay, no problem. So I just want you to just touch yourself. Touch my hand here. Okay. Then touch my hand here. Okay. 5 times. That's okay. Do the same thing here. Okay. You want to rest a little bit?
Yeah, I feel a bit tired.
Okay, just give you a little time to rest. Can you sit very well and then you sit properly? You feel any problem?
No, I just feel tired.
Oh, okay. Do you want to breathe in?
So
You breathe in. Breathe in.
like this?
Yeah, deep you breathe in your tummy
Yeah.
and you breathe out gently.
Like
Not,
this?
not very fast. You breathe in gently with the tongue, then you breathe out like you blowing out the smoke. Sorry, I have even forgotten the last time. Have you been a smoker before or not?
No, I've never smoked.
Okay, yeah, just clarifying that one. So the breathing exercise is when you're breathing with your tongue. You're breathing in, as if you're breathing something here, you can put your hand on your tummy, you're breathing. And when you're breathing, and then you blow out like you're blowing out a cigarette. Slowly. Yeah, slowly. Not so far. How do you feel now?
Feel a bit better.
Oh,
Yeah.
okay. Now, before you couldn't be able to pick something from the floor. I just want to see how you go with that. So before then, I want you to just turn to the right. Yep. Again, turn to the left. Turn to the right. Turn to the right. Okay. Now, I just want to just check now, see if you could pick this thing from the floor.
Yeah.
Yeah. Can you try and pick it from the floor? I give you an assistant here. I'm picking up paper. Oh, how do you feel? You feel?
Okay. I feel okay.
Yeah. Do you feel dizzy?
No, I don't feel dizzy.
Okay. So I'll do the same thing now here. Just pick it from the floor again from this place. I see that the therapist will be on that side, and you pick it from the floor. Oh, that's cute. That's cute. So before, and you can use it properly. Before you couldn't pick this pen from the floor, and then now you find very difficult to pick the pen from the floor. But now you could pick the pen from the floor, and then which is a very uh, very good thing. So suggest when you get back to the house, you don't need to pick from the floor. You just need to turn to the left.
Yeah.
Can you do that for me? You see?
Like this?
Yeah, to the left.
Yeah.
And then to the right. Yeah, let's do this one. I can do three, five, 10 times.
Yeah.
And do 3 times a day.
10 times?
Yeah, 10 times. 1,
Yeah.
2.
Like that 10 times and 3 times a day.
Yeah, 3 times a day.
Okay.
So I improve your improvement, and then also to improve your balance.
Okay. Yeah.
Okay. So and then that is the side, and I'm going to do the same thing in the front. So I'll ask you to touch my finger the other time, which is very good. I just want to check again. You could just pick from the floor here. Can you pick on the floor here? Your leg part, and try and pick. The therapist will be on that side. Very good. Very good. So also too, what you just need to do for when you get back to the house, you can just lean on your hand, and then back again. Can you do that for me? That's for one problem. Lean and back again.
Yeah.
Lean and back again. So this exercise you do you do the 5 times for this one.
Yeah.
And then you do 3 times.
3 times.
Technically 3 times a day.
Okay. 5 times and 3 times a day.
Yeah. So this one improve your balance. So your balance is very important, and then it goes a long way to help you. So that's very important. So and then for the leg, to improve your proprioception, to improve your proprioception, because it's very important too. So I'll just ask you what you just need to do. I want you to follow what I'm doing. Put your leg out.
It's really difficult, like tight.
Oh, okay, here. I'm going to do something for you here. I'm just going to give you a little bit stretch.
That's better.
Okay, can you do that again? Can you straight your leg and put your heel out and in. So this thing out, in, out, in. Okay, because what you just need to do, I'll put, because you didn't get that very well, so I'll put a point here for you.
Yeah.
Point. This is 1, 2, 3. I'll put a point. It's 1, 2, 3. 1, 2,
2,
3.
3.
Then you go back again. Then 1, 2,
Two,
3.
three. Yeah,
Yeah.
my legs are feeling tired
You
now.
feel like you don't want to relax a little bit?
Yeah, I think because I'm feeling the muscles are getting like tense and like a spasm again.
Okay, okay,
Yeah.
okay. Possibly then when you get back to the house, well, you for the you could do that just stretching yourself. Like get the towels, and then you put towels.
Do you think I can?
Yeah, you get the towels. You put the towels for your discharge place
Yeah.
for here. Put the towels here, and then for the leg for this one, and just put
Pressure.
pressure on it.
Okay, I'll try doing that.
You want to do that for me? Let me see. Oh, you're tired now?
I'm tired feeling.
Oh, okay. So these are the only things you do, and then now, significantly you're able to see improvement in your balance.
Yeah.
Before you couldn't do the dynamic balance, pick something from the floor, but now you could do that very well. And yes, the stretching for the home program, you just do the stretching, get the towels, put it a little bit for your hand, and then for the leg, you just press your leg and then stretch the leg,
Yeah.
and then that will improve. And then the exercise I give to you, you put it do the 1, 2, 3, the spot, and you bring it back again.
Yeah.
Put it up, and bring it back again. Time up.
10 minutes are still there.
10 minutes extra.
10 minutes are still there. 40 minutes are.
Okay, 10 minutes. So this is what you do.
Yeah.
So I'll give you all the letters. Is there any question you want to ask me again?
No, I feel fine.
Okay. Do you still want us to? Are you feeling? Do you still have any fatigue in your leg or no or not?
No, but I feel like if I do too much,
You
I may get a spasm. So
okay.
yeah. So
Okay. Have you taken your tablets for your spasm for your spasm?
I think I have, but when the spasm comes, that's when I take the muscle relaxant.
Oh, okay.
Yeah.
Oh, okay. Do you want to take the tablet now for muscle relaxant?
It's feeling fine right now, but if I do too much, I feel like it might.
Oh, okay. Oh, okay. So yeah, just need to do like I did the other time when you do the stretching, you can be able to move the leg, then be able to do.
Yeah.
Okay. Thank you very much, Mr. Steve, for today.
Thank you.